Hi, I'm Les Donahue, President and CEO at St. Thomas Hospital. On behalf of our entire healthcare team, I'd like to welcome you and let you know we're delighted that you've chosen St. Thomas Joint Replacement Center for your care. We have a dedicated staff here and the best surgical care available. Let us know if there's any way that we can make your experience here better and more pleasing. Thank you.
In this video presentation, you and your family will learn about your diagnosis, the procedure you're going to have, and what to expect during your recovery. Most importantly, you will learn what you need to do to prepare for your surgery. To help you understand your surgery, let's talk about how your joint is made. In a healthy hip, the smooth ball on the end of the thigh bone fits well into the hip socket to form a ball and socket joint. A layer of cartilage cushions the ends of these bones, allowing the ball to glide easily within the socket. In a healthy knee, the hinge joint, the upper leg bone or femur, and the lower leg bone or tibia connect and are surrounded by muscles and ligaments which support weight and allow the joint to work properly. The cartilage that covers the ends of these bones allows them to glide together while bending the knee. A total joint replacement is indicated when you have severe pain and decreased movement in the joint, and other forms of treatment are not successful. Most people that have total joint replacement surgery suffer from a condition called osteoarthritis. This is a condition in which the cushion or cartilage lining in the joint wears away. When this occurs, the joint becomes irritated and pitted as bone rubs against bone, almost like sandpaper.
Hip and knee replacements are simply metal and plastic caps, sometimes ceramic parts, but man-made surfaces that cover the ends of the bone where the cartilage has been worn away.
A total joint replacement replaces the old worn joint with a new mechanical joint called a prosthesis. In a hip, a specially designed ball and socket replaces your worn hip joint. The ball and stem replace the worn ball of the thigh bone, and an artificial cup replaces the rough hip socket. In the knee, the upper and lower knee components replace the roughened surfaces of the knee joint. The underside of the kneecap is also replaced. All prostheses, hip or knee, have smooth surfaces that fit together, allowing for easy, smooth movement. There are many factors that will affect how quickly you recover after joint replacement surgery. The most important factor is how prepared you are before your surgery. It's important that you tell your primary care physician that you have scheduled a joint replacement and follow his or her advice in preparing yourself medically for surgery. Before surgery, it's vital that you have pre-admission testing, attend the joint replacement class, start your exercise program, and make plans for continued care after your discharge from the hospital. Pre-admission testing is located on the basement level of the medical plaza. You can park in the physician's office parking garage, or you can make use of our free valet parking service located at the West Medical Plaza. Along with blood work, EKG, and other tests, you will also meet with a representative from the anesthesia department while in pre-admission testing. To make you feel more comfortable and prepared for surgery, a joint class is usually scheduled the same day as your pre-admission testing. The joint replacement class is located on the 5th floor of the hospital in the rehabilitation department. As a part of your joint class, you will receive an education and planning notebook with written materials to supplement this video. During class, you will meet with an orthopedic staff nurse, a physical therapist, and a nurse case manager. In preparation for your surgery, it's very important for you to begin your exercises to help strengthen your arms and legs. In class, a physical therapist will teach you exercises to perform prior to surgery.
We need everybody to make sure that their risk of infection is as low as possible. So many patients we ask to see the dentist to make sure they don't have an infection that they don't know about. And then we focus quite a bit on therapy before surgery. And those are simple things like getting your muscles as strong as possible, getting your motion in your joints as far along as possible before surgery. So as long as patients are ready medically and with therapy, then they're ready for surgery.
At the end of this video, you'll find a demonstration of the exercises and equipment that you may need. Most patients following joint replacement surgery will need to use a walker for a short period of time. You may also need to purchase special equipment for your home to assist you as you recover, such as an elevated toilet seat, grab bars in the shower, tub bench, reachers, long-handled shoe horn, dressing sticks, and sock aids. These may be helpful but may not be covered by insurance. Your physical therapist will help you determine what assistive devices you will need when you go home. Also, as part of your joint class, a nurse case manager will assist you in making a preliminary plan for discharge after your surgery. Most patients choose to return home and have therapy on an outpatient basis. The case manager will also visit you daily throughout your hospital stay to answer any questions. You may prepare your home by removing throw rugs from the floor, put non-skid material in the bathtub or shower, move frequently used items to a level reach, and prepare your refrigerator with items you can easily lift. You may also want to arrange a setup on the first floor that you can call your own for the next couple of weeks. Smoking must be stopped before the surgery and not resumed after the surgery in order to reduce the risks of wound infection and delayed healing. Smokers have twice the rate of wound infections, longer recovery periods, and are more prone to post-operative complications, especially involving the lungs. Therefore, in order to promote health, well-being, and safety of our patients and guests, smoking and tobacco use is prohibited at St. Thomas Hospital. Your doctor will instruct you as to what time you are to arrive at the hospital. It's usually 2 to 3 hours before your surgery is scheduled. On the morning of surgery, take any medications as directed with a small sip of water. Otherwise, do not eat, drink, or smoke after midnight the night before your surgery. This includes chewing gum, breath mints, sips of water, or dipping or chewing tobacco. You should bring a list of all the medications you are currently taking with the dosages to the hospital with you. You should bring contact lenses and glasses with cases. Bring a copy of your living will if you have one. You should not wear makeup or nail polish the day of surgery. After you arrive at the hospital, park in the flat surface parking lot outside the admitting and registration area next to the emergency department. Enter through the sliding doors into the admissions area and report to the admissions desk. From there, you will complete any remaining paperwork before being taken to early morning admissions, where you'll be given a gown to wear. Dentures, underwear, eyeglasses, contact lenses, jewelry, hairpieces, and hairpins must be removed prior to surgery. If you're staying at the inn at St. Thomas the night before your surgery, a gown will be in your room for you to put on after your morning shower. Approximately 1 hour before surgery, you'll be taken to the holding room located on the second floor. Once you're in a regular room, you will want a pair of loose-fitting shorts, comfortable rubber-soled shoes, robe, reading material, and toiletries. Please bring your walker with you to the hospital if you have one. If you're being treated for sleep apnea, bring your CPAP-fitted mask and tubing with your pressure settings. At this time, your family and friends will be asked to wait in the family waiting room on the first floor of the hospital. Once they're there, they need to sign in at the desk. The waiting room attendant will provide them with a cell phone in order for the physician to contact them and discuss your procedure. Your family will be able to rejoin you once you arrive in a permanent room. In the holding area, you will have an IV started for fluids and medications. Also, an anesthesia provider will talk with you and discuss what type of anesthesia you will have. Your medical history will be reviewed, and then anesthesia options, benefits, and risks will be discussed. Most orthopedic procedures can be performed with general anesthesia. The surgery generally takes 2 to 3 hours depending on the complexity of the surgery. After your surgery, your physician will contact your family and friends to discuss your procedure, and you'll go to the recovery unit where you will stay for the next few hours. As you awaken from the anesthetic, you may experience the following side effects: blurred vision, dry mouth, chills, nausea,